Welcome in. I am absolutely thrilled you're here today. We are going to jump right into a highly practical explainer. What we're looking at is a targeted, science-backed guide designed specifically for adults over 60 who are looking for non-pharmacological relief from peripheral neuropathy right in the comfort of your own home. Now, super quick but incredibly important note before we kick things off. If you currently have active foot wounds or any skin breakdown, you absolutely must have a physician guide your exercise protocol directly. But if you're cleared and ready to go, you are in exactly the right place. Today, we're going to look at your nerve environment in a completely new way.
Okay, let's dive right into this. We're going to tackle nerve damage not as some permanent wiring issue, but as an environmental problem we can rebuild layer by layer. We'll start with the neuropathy contradiction, then move on to rebuilding structure and sensation, restoring mobility and circulation, balance and targeted relief, and finally wrap it up with the layered healing approach.
All right, starting off with Section 1, the neuropathy contradiction.
Look, I know how incredibly frustrating it can be to feel like you have to rely entirely on medication or just resting all the time. While those have their place, neither of them restores what the nerve has actually lost. And neuropathy, well, it has this unique cruelty to it, right? It does something almost no other condition does. It causes a burning pain and complete numbness at the exact same time. It's crazy. The very same nerve that has just stopped telling your foot where it is in space, that's the shutdown part, is simultaneously sending a signal that your brain interprets as fire. It's a complete overreaction, and this contradiction, it isn't just a random malfunction. It means the nerve has been progressively deprived of what it needs to function normally.
So, here is a major revelation, and honestly, this changes everything. Nerves themselves need to move. Not just the joints around them, the actual nerves. A nerve that's become adhered or stuck to the surrounding tissue, usually through inflammation or just disuse, simply cannot transmit its signals cleanly. We absolutely have to shift our mindset from passive rest to targeted movement, because those nerves literally need to glide.
Let's move on to Section 2, rebuilding structure and sensation. So we're going to start from the outside in. Our first movement is called foot doming. Deep inside your foot, you have over 20 of these small intrinsic muscles. When they atrophy because we aren't as active, the nerve endings in the ball of your foot lose their structural support and take on way too much pressure. To fix this, you're going to sit with your foot flat on the floor. Now, without curling your toes, try to shorten your foot. Just draw the ball of your foot towards your heel by lifting the arch. Think of it kind of like trying to make a gentle fist with your foot, but keeping those toes completely relaxed. Hold that for about 5 seconds and then release. Do 10 reps per foot. This simple isometric hold reactivates those intrinsic muscles and rebuilds the mechanical support for the nerve endings without putting any heavy, painful load on the front of your foot.
Next up is the sensory stimulation walk. Now, this technique is actually drawn directly from diabetic foot care protocols used across Japanese rehab medicine. Sensory nerves that aren't regularly stimulated, they just decline. So we have to feed them. Stand barefoot on a folded towel while holding a wall for balance, and just shift your weight around for about 60 seconds. As that gets easier, progress to something like a textured bath mat, or, and stick with me here, a shallow tray of smooth dried beans or rice. Yes, you are literally going to stand in your groceries, but trust me on this. It is absolutely not about discomfort, it's about providing varied textures to feed crucial signals back into sensory pathways that have basically gone to sleep from disuse.
Still working on structure and sensation, we have towel scrunches and marble pickups. Place a simple hand towel flat on the floor and use just your toes to scrunch it up toward you. Or, if you're feeling up for a real challenge, use your toes to pick up 5 marbles, one by one, and drop them into a cup. This direct gripple motion is fantastic because it specifically targets and stimulates the small fiber nerves that are responsible for fine touch sensation right there in your toe pads. Every time you grip, you compress those digital nerves, and when you let go, you decompress them. It's a great way to keep them active. Let's move on and see how this builds in Section 3, restoring mobility and circulation. Our next movement is nerve gliding. Remember earlier when we talked about nerves not just being static wiring? Well, with every single step you take, your sciatic nerve and its branches actually need to slide several centimeters. If they're tethered down by scar tissue, they can't travel their full range, and that messes up the signals. So, sit upright, fully extend one of your legs, and flex your foot so your toes point right up towards your shin. Hold that for 3 seconds. Then, at the same time, bend your knee and point your toes away from you. Going back and forth like this is essentially flossing the nerve. It frees the sciatic and tibial nerves from inflammation and scar tissue all along their path.
Exercise 4 is the ankle alphabet. Did you know the primary blood supply to the nerve endings in the sole of your foot, the tibial artery, runs right behind your ankle joint? When your ankle mobility decreases, it slows circulation down there, literally depriving those nerves of oxygen. So sit in a chair, lift one foot, and trace the entire alphabet in the air with your big toe, moving only your ankle. Print, cursive, uppercase, lowercase, it is totally your choice. Just make the letters as large and exaggerated as you comfortably can. These big, deliberate movements are an amazing way to combat poor circulation by maximizing the blood flow right through that tibial artery.
Moving right along to section 4, balance and targeted relief.
And this brilliantly illustrates a truly fascinating concept, proprioception. Proprioception is the silent sense that tells your brain exactly where your body is in space without you ever having to look at it. It's the reason you can walk across a pitch-black room at night without falling over. And the tragic thing is, neuropathy damages the exact sensory fibers responsible for keeping us upright and confident on our feet. That is exactly where exercise 6, the proprioceptive balance challenge, comes into play. Stand up and hold onto a wall or a counter. Shift your weight entirely onto one foot and just hold it for 10 seconds. Over time, as you get better, try to gradually reduce your finger contact on the counter, eventually working your way up to standing on a folded towel. Now, let's be clear, this doesn't magically reverse nerve damage. But what it does do is force your nervous system to work much harder with the sensory input that it still has. It preserves those remaining functional pathways substantially longer than passive rest ever could.
Okay, for our next point, we really need to talk about a specific anatomical roadblock, the tarsal tunnel. It's a very narrow passage right on your inner ankle. When the connective tissue there thickens or swells up, whether from age or just being a bit less active, it physically compresses the tibial nerve. Because the nerve branches out from this exact point into the sole of your foot, a compression right here at this choke point can easily mimic generalized neuropathy symptoms across your entire foot.
Which brings us to our final movement, exercise 7, tibial nerve mobilization. You'll want to rest your foot across your opposite knee. Slowly turn the foot inward and downward while curling your toes. Hold that for 3 seconds to give the nerve some slack. Then reverse it. Turn the foot outward and upward while gently pulling your toes back toward your shin for another 3 seconds. This applies very targeted tension directly at that tarsal tunnel choke point. Now, a crucial tip. You must do this exercise last in your session when your tissues are already nice and warm. And listen to your body. It should only ever feel like a dull stretch. If you feel sharp pain, back off immediately.
And finally, section 5, the layered healing approach. Just look at how beautifully all these layers fit together to create a complete healing strategy. We aren't just trying one random thing. We're treating the whole environment. You've got foot doming to rebuild your structural support, the sensory walk to feed vital input to your brain, nerve gliding to restore mobility along the whole leg, the ankle alphabet to keep that circulation pumping, towel scrunches to wake up those fine touch fibers, the balance challenge to preserve your nervous system pathways, and finally, tibial mobilization to relieve local compression. If you can dedicate just 20 to 30 minutes a day moving through these specific layers, the cumulative effect over a few weeks is highly meaningful. I really want to leave you with this final thought today. You now have the structured knowledge to actually rebuild your nerve environment layer by layer. You don't have to be stuck in the frustration of just resting and hoping for the best. The only thing left now is action. So, out of everything we discussed, which of these 7 exercises will you start with today? I encourage you to pick just one to try right now and take that first step in reclaiming your mobility. Thank you so much for joining me on this explainer, and happy healing.